Good afternoon and welcome to today's webinar, Medicare 101. My name is Tammy Cave and I am a management analyst and caregiver specialist with the Caregiver and Supportive Services Unit here at the Fairfax County Area Agency on Aging. Before I get started today, before introducing our speaker today, I will give a quick disclaimer and go over a few housekeeping items. The disclaimer is that today's presentation is not intended for broker or agent education. We have not shared the slides for today's webinar because the presentation is proprietary and not for distribution. If you have any questions about Medicare, please get in touch with the Fairfax County, Virginia Insurance Counseling and Assistance Program, or VICAP. Please call them at 703-324-5851. If there is no answer, please leave a brief message with your name, telephone number, and a good time to reach you. This number is to VICAP's intake line. Today's presentation is being recorded, and a link for the recording will be sent to all registrants a week from today. I would also like you to know that today's webinar has closed captioning enabled. There is a Q&A button at the bottom of your screen where you can submit any questions you may have. We are going to allocate a few minutes at the end of the presentation to address as many questions as possible. We will provide the VICAP contact information in our follow-up email after the webinar for any questions that you may have. There will be a brief survey as you sign out. We ask that you please take a moment to fill out that survey because it helps us to create programs that are important to you and interesting to our caregiving community. In addition to the Area Agency on Aging survey, each of you will also receive a survey, satisfaction survey from VICAP and the Administration for Community Living. You should have received a link in the email to access and submit that survey. Please complete both surveys as they should only take about probably less than 5 minutes to complete. Now it is my pleasure to introduce today's speaker, Mr. Bill Vaughan. Bill Vaughan has been a VICAP volunteer for over 8 years. He worked on Medicare issues most of his career, serving in government for 36 years. And he was also a registered lobbyist for the Consumers Union and a publisher of Consumer Reports magazine. Bill, thank you so much for being here today. We look forward to your presentation today. Please take it away.
Oh, thank you very much. And thank everybody for being here. I hope we can save you some money and give you some good ideas or understanding of the program. You'd be surprised how many people call us and say, I turned 65 a couple of years ago. What's all this Medicare stuff? They've probably missed some chances to save real money. And two, it ain't that complicated. There's a bunch of people who'd love you to pay them money to navigate Medicare, but just because we turned 65 doesn't mean we turned stupid. If you can drive the Beltway or figure out a Metro fare card machine, you can figure out Medicare. Promise, it's not that hard. Well, who are we? Tiny little office in your county government and contacts and website and all that. And basically it's a volunteer operation. There's 2 full-time staffers, but our goal is to provide independent, no conflict of interest advice on your Medicare choices or your Medicare purchases. And that is so important. There's about 80, 90, almost all for-profit companies trying to sell you stuff in Medicare. And they make a lot of money for every person they sell, and they make commissions on every sale. And that has led historically to exaggerations, sometimes lies as to the products. And you have to be careful, caveat emptor. I always kind of thought, when I got old, Mother Teresa would come and take care of me and it'd be all nice and charitable. No. Caveat emptor. Approach this like you're buying a used car, kick the tires, ask hard questions. These are not charities. And there is fraud and abuse in this sector. So be careful. Um, I may sound a little pessimistic sometimes, but I spent a lot of my time in government on anti-fraud issues, and be careful. Again, our intake number, the name of the full-time staffers, and good sources of information. And the big one is that first thing on the screen, Medicare.gov. Really good website. This is the website for the health plan for the rest of your life. I would urge you to spend 10 minutes just looking at it. And I think you'll see you don't need your kids to help you with this one. It's really good. And you can go on and read electronically or order a hard copy of this really good publication. Looks a little intimidating. It's not. The key pages are page 9 to 12, and then you get lots of detailed information about the different benefits in Medicare. But this is good. You can go into Medicare.gov and shop for the different drug plans, the different managed care plans that we're going to be talking about, and get detailed information about those plans and even enroll online. I don't know about you guys, but getting a bunch of mail, advertising, throw all that stuff away. Just throw it away. The way to shop for a Medicare plan, drug plan, or managed care plan is to go to Medicare.gov, you put in your zip code, and the different plans will be ranked from the lowest estimated cost to the highest, and you can actually enroll online. You can get information on the quality of our local hospitals and nursing homes and hospices, and you can find the names of doctors near your zip code by specialty who are recently been taking Medicare patients. It is a gold mine of information, and uh, as I say, most importantly, the way to shop for these different products. Um, I think it's become a big program, $1 trillion this year. Um, what's different from your working years is it's you and Medicare. You have a Medicare number. You can pick a plan. You pay premiums. Your spouse, if you have one, has his or her own number, can pick their own plan, pay their own premiums. There's no family group rate. And in the very, very, very rare event that you'd ever have to physically give something to Medicare, don't go looking for offices. To save money, they use the Social Security offices. And if you need something, make an appointment there. Don't just show up. This is from last month's ARP magazine. Congress has really cut the budgets, and the Social Security offices, that staff is so overworked. You just show up, you're going to be sitting around for a couple hours. Make an appointment. Um, and let's move on. What I'm going to talk about today is your key choices. Medicare has like 4 or 5 colorectal cancer preventive benefits, like barium enemas. I'm not going to talk, you're going to be happy. I'm not going to talk about barium enemas. We're going to talk about, if you want to know about barium enemas, go to Medicare and You or the Medicare.gov website. The big issues that we're going to talk about today is, should I join original, traditional, fee for service? I go to the doctor, she or he provides a service, Medicare and I pay the fee. Should I join original, traditional, fee for service Medicare, or should I join one of these companies like Kaiser and ARP United, Aetna, Humana, whatever, and get my Medicare services through them? I think most of us have heard of that great Robert Frost poem, Two Roads Diverged in a Wood. Medicare has 2 roads, original, traditional, fee for service Medicare, or one of these managed care plans like Humana or Kaiser. In Robert Frost's poem, I took one of those roads and it made all the difference. It makes a big difference which road you pick in Medicare. Hey, this is the first of two Medicare 101s, and the second one is 102. I'm going to go over some of the differences between these two roads pretty quickly today, throwing a lot at you. And in 102, we're going to really dig into those differences because they're very important. And if you want to know more about these managed care plans and the difference, tune in a week or so to the 102. But today we'll touch on it. The second big issue is, should I get Part B, which is doctors and all the things that doctors order, like lab tests and wheelchairs, and pay the premiums for that? And if so, when should I do that to avoid late enrollment penalties? Three, if I don't have drug coverage from my work or union, how do I get a good Part D drug plan? And then the last one is, if I choose original traditional Medicare, I think that's this hand, okay, original traditional Medicare, and I do not have a good retirement plan like retiring federal workers do or retiring county teachers do. If I don't have a good retirement plan, should I get one of those Medigap Medicare Supplement? Same thing, interchangeable words. Should I get a gap or sup policy to fill the financial gaps in Medicare? And this is a place where I think we can save you literally thousands of dollars over your lifetime. Good news is, if you make a bad choice, you join a drug plan and boy, they can't answer the phone, you can fix it each fall during the open enrollment period that started yesterday, October 15th, and it ends on December 7th, Pearl Harbor Day. And you can make these switches, no questions asked. You could be on death's door, literally. You could be in a hospice, and you can switch plans, and they cannot deny you coverage because of a pre-existing condition. So this is an open enrollment period. What you can't switch, and we seniors seem to be terribly confused on this. At the end of every one of our physical meetings at libraries, somebody will say, when can I change my Medigap or sup plan? No, there is no open enrollment period for the Medigap Medicare Supplement Plans. For most of us, there's exceptions, but for most of us, buying a Medigap Medicare Sup plan is pretty much a lifetime commitment. And we're going to stress that, talk about it some more. The bad news, you need to do some of this stuff in a timely manner, or there's late enrollment penalties that we'll talk about. And the really bad news, particularly this year, we're seeing a lot of changes in how the drug plans cover things and how these managed care plans cover things, more than usual. So if you have one, if you're somebody already on Medicare and you have a drug or a managed care plan, be sure to check for changes. They'll send you a notice every late August, September of the changes. It's like a little pamphlet. Wow, nobody reads those things. It's tedious. It's like looking at a little phone book. You say, I'll do that tomorrow. I had a case 3 years ago now where a person was taking 3 drugs, 3-month supply, and under the Part D drug plan the person was in, they were paying $80 for those drugs. Not bad. The person did not read the little pamphlet about changes, went to the drugstore in January, those same 3 $80 drugs, $800. And you're stuck in that plan for the year. Once the year starts, there are only certain times you can change these plans. So every fall on October 15th, I would put on my calendar, spend 10 minutes on Medicare.gov to make sure that the plan you picked this year is still going to be good next year. Think about it for a minute. These are, I said, 80 to 90 for-profit plans. If they're losing money in Fairfax County this year, what are they going to do? For their stockholders, they have to make money. They will change the plan in the new year to make money. They will change what drugs they cover or how much you have to copay. They'll drop expensive doctors. They'll do something to make money. And that something can bite you in the butt, which is a very technical term that I use. So be careful. Watch them. These are not charities. To make choices, you need to know the basic lingo, which we're going to dig into. Medicare has 4 parts, A, B, C, and D. Whoop. No Medigap part, no Med Sup part. These are private insurance companies. I cannot stress this enough. Regulated at the state level. There are some federal consumer protections enacted about 35 years ago, but not nearly the protections you have in the government, federal government Medicare program. Part 8, hospital type stuff, kind of automatic at 65 and it'll feel free. And I hope you're all giggling because we've reached the age where you know there's no free anything. Very few things free. This is a prepaid benefit. That Social Security tax you paid all those years you were working, a little bit of it, try to coordinate it, a little bit of it was moved over to the Part A Hospital Trust Fund so that when you turn 65, you don't pay more in premiums. It'll feel free. And it's a pretty good benefit. If you're in a hospital 3 nights, you actually earn help with up to 100 days in a skilled nursing facility, a SNF. It's for, rehab after a stroke or something. But last paragraph on this slide, the first day you go to the hospital, if I have a heart attack talking to you guys, and they take me away, I would owe the first day deductible, which is equal to the average cost of a hospital stay in America, $1,632. And what's goofy is it works on a 60-day admission cycle. If again, I've had the heart attack, I pay the $1,632. The next day I wouldn't pay anything and clear up to the 60th day. And then there's a copay that would kick in. But in this example on the slide, on day 4, I go home. I leave the hospital. If I'm out of the hospital for 60 days, the cycle starts over. So that if I had a heart attack on my 65th day in this example, I'd owe another deductible. And you think about it, that could happen 3-4 times in a year if you're really, really unlucky. So understand that, or plan your second heart attack for around day 30, and then you wouldn't have another deductible, but that's hard to do. Part B. This is doctor stuff, doctors and the things doctors do for us. This is optional. It's voluntary. You don't have to take it. Low-income folks might pay less, and higher-income folks will ask to pay more. We'll talk about that. But for most of us, the monthly premiums per spouse, per person, is $174.70. A lot of money. Folks, it is an incredible bargain. If you were to try to buy this package of insurance at age 64 on the private market, it cost about $800. Our kids, the Treasury, the taxpayers subsidize 3/4 of Part B for most of us. So yeah, a lot of money, but there's a lot of stuff provided under Part B. It basically covers 80%, in some cases even 100% of all the stuff doctors do. And we seniors worry that doctors aren't seeing Medicare patients. And it can be tough to find a doctor with openings. who has time to see you, particularly in psychiatry and in GPs, general family practitioners. But the data is very clear. 90% of the nation's docs are seeing Medicare patients, and the Medicare.gov website will give you the names of ones near your zip code who've recently been seeing people. And your assignment is to find the doctors who take assignment. That's a technical legal term. And they're also known as participating doctors, the people who accept the Medicare fee schedule as payment in full. Of the 90%, about 2% don't take the fee schedule. They're non-participating doctors, and they can charge you 15% more. Oh, what the heck? If most of them are taking assignment, go for those guys. What you want to avoid are the doctors who have opted out. If a doctor's opted out of Medicare, you pay the whole bill, the government and pays nothing. And that's about 2, maybe 3% of the docs, particularly about 30% of psychiatrists. I've seen data. By the way, the 90% number, a little low, because think about it, if you were a pediatrician, or if you were maybe even an OB-GYN, you'd say, this is not my audience. Why bother with the paperwork and the government rules? I'm not joining Medicare. But most doctors, yeah, they're seeing Medicare people. Part D makes sense. D equals drugs. Again, voluntary, run by about 14 private companies in our county in the coming year. And the premiums vary widely from $0 to over $100. Please, everybody promised me you would never, ever shop for one of these products just on the basis of premiums. Would you go to a car dealership and say, I want the car with the cheapest tires? You don't look just at premiums. You look at premiums, deductibles, copays, and that's what the Medicare.gov website will show you. Again, you need to check these plans each year. All of that example of the $80 became $800. And this was a pretty crummy benefit when it started in 2006. It has become a wonderful benefit in just this year and the next year. And third paragraph down, in 2025, once you have spent, between your plan you've joined and you have spent, I'm sorry, let me back up. Once you have spent $2,000 out of your own wallet, purse, you're home free. You owe nothing more if the drugs are on the formulary, on the list of drugs that the company covers. Why I'm excited about this, the worst case I ever had was about 4 years ago. A person called and to live had been prescribed $842,000 worth of medicine. And the way the law worked before this year was basically you paid 5% of large drug bills. 5% of 840, about 42,000 a year this person was paying for drugs. That's not insurance in my book. And now that person will pay $2,000 next year, $3,250 this year. So the drug benefit really has become important. Good news. Part C is these managed care companies, also known officially as Medicare Advantage. And I like this slide. It's the formula. Part C equals how to get your A, hospital benefits, how to get your B, doctor stuff, and usually most of them cover drugs. So it's how to get your drugs. And these plans, the value of what they offer equals the value in traditional Medicare. An important note here, if you go this route, this road in Medicare, you can't use a Medigap policy, which leaves you with some copays and deductibles. By the way, let me back up one thing. Medicare Advantage, about 21 years ago, a bunch of people in Congress wanted more of us to join these things. The previous name was pretty stupid. And they said, look, let's call them Medicare Advantage. Whether they are an advantage or not will depend on you and your health, the quality of the plan you pick, luck. I have a friend who had a horrible experience with a company and calls them Medicare Disadvantage, which is a little harsh, but they're not necessarily an advantage. That is a congressionally mandated marketing term. Caveat emptor. These things have been growing, but in the nation, more than half of folks are in them, 51, 52%. In Virginia, the number is much lower, maybe in the 20s, we think. But it's growing, and that's why Medicare 102 will really dig into why they're growing so much. If you join one of these things, you got to pay the Part B premiums, the 174 number, and you may be asked to pay a premium to the company. And there's some zero premium plans in our county, a lot of them, but you can pay $100 or so for a premium. And how they work is they contract with a set of doctors and a set of hospitals and encourage you to use those people, what's called the network. And if you go outside their network, you usually pay more, or you have to get permission, or there's different rules. And but they manage your care by pushing you to use the people they've contracted with. And what's different is the copays, the deductibles, and the rules can be different. Instead of having that $1,632 first day deductible for a hospital, they might say, hey, $500 for each of the first 3 days or 4 days, things like that. And that's part of what you shop for. It's kind of cool that the law requires them to have a catastrophic benefit. Once you spend, and again, this will vary from plan to plan, but once you spend $3,000 to $8,000 or so in out-of-pocket expenses, deductibles and copays, you're totally protected, a catastrophic protection. And because they've been able to save some money, the government has required them to give some of that savings back to us in extra free stuff for things that Medicare doesn't cover. Medicare doesn't cover eyeglasses. Maybe one of these plans would cover a couple of eyeglasses a year, or dental cleanings, that sort of stuff. And that's cool. Maybe this helps. Original traditional Medicare, you got that CMS agency up in Baltimore, and they have rules on what they'll pay hospitals and doctors. The drug benefit goes through private companies like Express Script and Silver Script and things like that. In Medicare Advantage, government contracts with Kaiser, Humana, and they pay the hospitals and the doctors and the drug companies under the rates they've negotiated and under their rules. So there's an intermediary level. Hope that helps explain what's going on. Extra benefits, if you join a Medicare Advantage plan, to get the extra benefits, probe hard on how much, whose approval do I have to get to get that extra benefit? We have found a lot of exaggeration here, and the government has tried to crack down on, I don't remember, Joe Namath used to do ads on promising a whole lot of stuff from these plans. Some of those ads, wow, caveat emptor. Medigap, Medicare Supplement Plans. This is for only if you've chosen original traditional Medicare, and you don't have a good retirement or health plan, they cover the financial gaps of A, like that big deductible, and B, but not D. In the drug field, you're going to have copays and deductibles, heavily regulated by our Bureau of Insurance. A good comprehensive one costs about 120 a month and will go up as you age. By the time you're 80, you're probably looking at $300-400 a month for a comprehensive one. But a place to save money. And lower income can get help if your income's below these levels. Check with us or check with the Medicare and You handbook, because there's help. And the lower your income, the more the help. And please, anybody hear a neighbor or friend say, I can't go to the doctor because I can't afford that 20%, or can't fill this prescription because of the dang copay, have them call us. There's about 14,000 people in this pretty expensive county that we're in who have not signed up for these programs and aren't getting the help. Or if you're among the 7% whose income is above what's on the screen, and that number is about to change. We don't have the New Year number, but it'll inflate with inflation. You're asked to pay more. And this is a little complex, but you'll see the first line, the 25%, is most of us. We have incomes below 103,000 for a single. As your income rises, you're asked to pay a higher and higher percentage of the cost. The complication, and it really is a complication, is that between the time the IRS knows what your income is and tells Social Security, there's a 2-year lag. You say, well, that's nuts. In this slide, in 2023, my spouse died, or we got divorced, or we retired, and we're not living on that. This is crazy. Let me go back a slide. You go to Social Security, you get a Form 44 and tell them you've had a life-altering event, and they will adjust the premiums to reflect what you're really living on. This does not count a big financial asset that you cash in. Say you got a beach house at Ocean City. You sell it. That could put you in a higher bracket for a year, and you'd pay these higher premiums for a year. They'll go back once you're no longer reporting that surge of income. This is a place for some tax planning in terms of required minimum distributions and that sort of stuff. A lot of things Medicare doesn't cover. We talked about the eyeglasses. The big one is just getting old and frail and demented, particularly Alzheimer's. Medicare is a great program if you get hit by a bus or have COVID. If you have long COVID forgetfulness, it's not good. It does very little in long-term care, which is a way of saying you need to plan. You can't spend it all on grandchildren. You can't spend it all on cruising. Your budget will increasingly be nibbled at by medical expenses, because medical inflation historically has always been higher than general inflation. And you need to set aside some of that money. I've thrown a lot at folks. That's why it'd be good to tune in on 102. But these are the basic, and let's go on to choices. When you first start Medicare, you've got those 2 roads. Original, traditional, fee-for-service Medicare. You've earned Part A. If you don't have a good company or union plan, you get Part B, Part D for drugs, and you'd probably want to get a Medigap policy. You wouldn't want to pay that $16.32 more than once a year, would you? Or you can say, hey, Humana, take care of it for me. I'm going to join you. I do have to join Part B. Humana, I'm going to rely on your drug plan. And hey, I can't use a Medigap policy, so I'm not going to buy one. Spend a couple $1,000 a year on something I can't use. Little simpler. Can you switch? To me, this is the biggest single problem in Medicare. That switching is not always easy. Yes, during the fall open enrollment period, I could go from traditional Medicare over to one of the managed care plans. If I'm in a managed care plan, I can go over to traditional Medicare. But in the process, I might lose my Medigap policy, and then I'd be stuck with those 1632 hospitals and the 20% of brain surgery. And anyway, you can see what I've underlined and put in highlight there. Think about it. 65, you start off in traditional Medicare and you buy a Medigap policy. At 68, I see all those ads. I know I'm going to need some dental work, and this plan will give me $1,000 worth of dental stuff. I join the plan. At age 70, I'm diagnosed with some horrible disease that only some genius at Mayo in Minnesota covers, and Mayo is not in my plan's network. So to live, I go back to traditional Medicare, which will treat me at Mayo. Imagine. Then you call your Medigap company, say, hey, remember me? Will you take me back? Sure. I'm facing a couple $100,000 in surgery and hospital stays and medicines, but will you take me back? When they quit giggling, they'll probably hang up the phone on you. Or they will say, we're going to charge you more. Look at that beautiful back of my hand here. So all those stitches, I've had 3 skin cancer operations. If I tried to get a Medigap policy at this point in my life, the company would say, fine, Bill, we're not going to cover anything to do with your skin. You may have a proclivity to cancer, so we're not going to cover that. Or, sure, Bill, we'll cover $10,000. We'll charge you extra for it. Don't think you can get a Medigap policy once you get older and have an illness. We'll talk of, there's strong pros and cons to Medicare Advantage versus fee for service. We'll talk about this in Medicare 102. But today, if you do choose one of these plans, our recommendation, pick one that covers drugs, call your doctor and say, the doctors, that are important to you, that you care about, hey, if I join Humana, will you see me in the morning? Will you see me tomorrow? And don't rely on the websites. They have been badly out of date or even fraudulent in a case of a couple companies. Medicare has a quality star rating system. 5 stars is tops. Cool. It's based on hard data of how the companies do. What's not cool is there's been grade creep. And the average quality stars in our county is 4.1 stars. If you join a plan that has 4 stars, you're picking a below average plan. They can barely answer the phone in some cases. So go for the higher quality stars and probe on the extra free stuff. Part B issues. There's 3 common scenarios. You turn 65 and you don't have insurance, for gosh sakes, get it, because it's 3/4 subsidized and it's important to have doctor insurance. You do it around your birthday. Or if you don't, you could face a late enrollment penalty for the rest of your life, and it's significant. It's 10% of the premiums for that year. So this year it'd be like almost $18 a month per month till you die at 110. That's a lot of late penalty. Special enrollment period. This is, I think, most of you are interested in. You have health insurance because you're actively going to work in not a small business, but a middle-sized company or bigger. You're actively working, or your spouse is covered because you are actively working, or they are actively working. And you finally quit. You might quit at age 90. And you say, hey, I never wanted it in Part B. I didn't want to pay that premium and pay whatever the company wants me to pay. So you haven't joined. Once you finally quit, you have 8 months To join Part B, no late enrollment penalty. A little glitch. Don't ever let there be more than 2 months gap in good drug coverage. We'll talk about. But this is called special enrollment period. Or let's say you have a company plan, you like it, and you want to keep it. Just be sure till you die at 110 that that company never goes bankrupt. Because if it does, and you need to get doctor insurance, you could have a huge late enrollment penalty. To federal workers, retiring federal workers, I want to call out, this is kind of like Consumer Reports magazine. There's a Washington Consumer Checkbook, nonprofit group, and they have a yearly publication. A new issue will be out momentarily. Guide to Health Plans for Federal Employees. There's a retirement chapter in here that gives the pros and cons of federal workers getting Part B. Really worth getting from your library or buying. It's about 11, 12 bucks from Washington Checkbook. Or, hey, and this applies to county retirees. What if your company plan's very, very, very expensive? I had a person call me a few years ago, was paying the boss 1,400 bucks a month to keep their wonderful retirement plan. Well, it should be wonderful for 1,400 bucks a month. Think about it. You can get Medicare and dental insurance and vision insurance and Medicare for around 500 a month. And if you need to do that for your spouse, another 500, but it ain't 1,400 bucks. So sometimes that company plan is a white elephant that you want to get rid of. County employees should take a look at this. Talk to your HR departments. If you have health savings accounts, check the rules on that, or you could have an IRS penalty. Check the rules on COBRA insurance. There's some little special stuff there, or give us a call. Part D, drug coverage. If you don't have creditable drug coverage, that's a legal term. It means coverage as good as or better than the standard Part D package. Get it, or you start to run a late enrollment penalty. It's a little penalty, but it grows each month for the rest of your life that you don't have drug coverage. And we get people say, baloney. I just take one generic and I can get it from Walmart for $5. Why should I join one of these plans? Hey, we have a zero premium plan in our county this year and coming year. Costs you nothing to join. And by joining, you prevent any late enrollment penalty and you have insurance. None of us know if we're walking around with hepatitis C, the silent killer, and costs, I believe, $60,000 or so in medicine to save your life. You would have insurance, and if it's not perfect, you can change in the fall open enrollment period. Or on the left side of this slide, you're taking a ton of pills. Go to the Medicare.gov website, you put in your zip code, put in the pills you take, you pick among 5 different drugstores near your house. And it'll rank the different plans from low cost to high, and you can enroll online. The key issue here, make sure the pills you care about are on the plan's formulary. The other key issue is check them each year. A lot of studies show we're all bitching and moaning about the high cost of pills, a little bit of shopping, and most of us could save money. Medigap. We're getting close to the end here, folks. Medigap, if you don't have a good retirement plan, like federal workers, you might want to buy one of these. And there was a lot of fraud in this sector. And 35 years ago, Congress said, hey, companies, quit selling ticky little differences among the plans. Let people shop on the basis of price. This is on page 76 of the Medicare and You handbook. Standardize. And they came up with 8 different model plans. And most Virginians, I think, are going with G as in George. And you can see why. Look at all the check marks. The G's cover everything, every gap in Medicare except an annual Part B deductible, which this year is about $240. Next year it might be, I don't know, 255 or something. But after that, everything's covered. And all G's are identical. There's no G plan that has something extra or something less. And they have nothing to do with your health. They're bill payers. They're just cutting checks to the hospitals and the doctors for the part that Medicare didn't pay. Why not go with a low-cost one? These guys don't send visiting nurses to your house. They're bill payers. This is a great place to save money. And the time to buy one is after you're 65. And then in the first 6 months that you have joined Part B, you could be 90. You've been working until you're 90 and you finally retire. You join Part B. That's 6 months. All 50 companies selling these things in Virginia have to sell you their products with no medical underwriting. They can't look at my hand and say, Bill, they got to sell to you at the best price out there and easy to shop. There's about 50 different companies. Our Bureau of Insurance, that website's terrible. Just Google Virginia Bureau of Insurance Medigap chart book. And they used to give us printed copies, but now it's all online. But what it looks like is the companies are down one side of the page and the model plans across the top and the prices. And you can find the 2 or 3 lower cost plans for you and decide which one you want. They give inflation history on those and give you the contact to sign up. If you're in the 6-month window, they got to take you. So real easy. You don't need all that stuff you get in the mail. Enrolling in Medicare Part B and generally D. If you're getting Social Security benefits, they'll send you, they'll automatically enroll you in A and B. And if you don't want B, you say, hey, no, guys, not now, not yet. Or you can enroll around your birth month. There's a general enrollment period, first 3 months of every year. There's a slight danger that you could not have coverage for a couple weeks if you don't plan ahead. See, check the effective dates if you do the general enrollment period. And then special enrollment, what we talked about, that you're still working and have coverage. At the bottom paragraph is just that you're going to have to get a form from your employer that, yeah, I've had health insurance. I shouldn't pay a late enrollment penalty. And all your HR departments know about this, and it should be easy for you. And last points we're going to talk about in Medicare 102. So it leaves some time for questions today. How are we doing on time? Are
Good. We got about 12 minutes.
12 minutes?
Perfect.
Okay.
You ready for your question?
Sure, give it a try.
All right, Tammy, can you come on and join us?
Yes. Okay. So we do have some questions. Bill, we want to thank you so much for the insightful presentation, for sharing your expertise with us. I believe the information you've shared will be useful to those in our audience today. We do have a few questions. Number one of our attendees says this webinar seemed geared towards people who are 65 plus. Is there any advice that you would change or alter if I am here for someone with a disability?
Yes. In the last couple years, I'm sorry, this is pretty amazing. I'm afraid 9 million Americans are on Medicare under age 65. There's even babies born with health insurance through Medicare. For people who've been disabled and can't work. A couple years ago, the law was changed on Medigap in Virginia that the companies have to offer one of those 8 models to the people under 65. And most of those policies are still a crappy, that's a technical term, crappy deal. They only offer Plan A and which is the minimum one. And most of them are still very expensive. But by shopping, you can find at least a couple companies offering a somewhat reasonable plan A. But when you turn 65, that whole universe of the different models, the G's that would give you really comprehensive coverage, open up. And the fact of turning 65 is you can get a good price on them. So put it on the calendar on this friend's 65th birthday. There's going to be some help. Hopefully somebody will change the law between now and then and make it better. But that's an important thing for folks with disability to be aware of.
Okay. So our next question, so if you have good government retirement insurance, are you saying that we don't need Medicare gap once we've signed up for Medigap, you cannot get off?
Okay, government workers. The big issue for the federal community is, should I bother with my Part B premiums? And this neat book has this retirement chapter. I hope there's probably several feds on. So real quickly, the data shows that you're not likely to save if you get a Medigap policy, you are probably going to spend more on Medigap premiums than you will save in reduced copays and deductibles. The guy who's been writing this, wonderful guy, for about 30 years said, nah, the data shows you don't need to get Part B. You are going to spend more on premiums than you will save in the copays and deductibles that Part B would cover. About 3-4 years ago, he said, as you get older, you get more financially conservative. This isn't a crapshoot or a trip to Vegas. Get Part B, and you never ever have to worry about copays and deductibles. As a retired Fed, I took Part B. It's true. For 10 years, I was real healthy and I wasted all those Part B premiums. And then I had a pretty major thing and I paid zero in copays and deductibles. So total peace of mind. I don't worry in the middle of the night about having a big copay. And so federal workers, if you want to get Part B, you get peace of mind. You want to probably most years save on Part B premiums, don't get it. And whether you get a Medigap policy or not, if you have Part B, you've got full coverage, so you wouldn't get more coverage in a Medigap policy. I'm sorry, if you want to buy a Medigap policy, the law requires you to be in Part B. Don't get both Part B and a Medigap policy. Now, you've touched on a question I bet almost everybody has. Once I join a Medigap policy, yes, I can leave it, but getting back in is tough. There are 2 pages of exceptions to that statement, but they're kind of Philadelphia lawyer, specialty issues. In general, if you leave a Medigap policy and join a Medicare Advantage plan and leave it within 1 year, you can get an old policy back. But if you're in that plan for a year and a day, no, you will be medically underwritten. So there's a whole pamphlet Medicare gives on buying Medigap policies that you can get through a Medicare.gov website on these exceptions and rules. But in general, most of us, if you buy one of these policies and you give it up and try to come back after more than a year, they're going to say, you're older, you're more likely to be sickly, or tell us about your medical history in the last year, and they will medically underwrite you.
Okay.
Make sense?
Thank you for that. So the next question is, how does TRICARE for Life fit into the Medicare decision?
Congratulations. Thank you for your service and all. But in general, you'll need Part B to use TRICARE in retirement. There's a neat, I would urge you to Google Medicare and TRICARE. There's a couple neat publications that show the coordination. Yeah, Part B is part of that equation for probably the nation's best healthcare.
The next question is, my parent has A, B, and D traditional Medicare, but Medicare made her choose a plan like Humana. So even with,
No. Okay, I'm sorry. Go ahead.
okay, so even with not having Medicare Advantage, you still need to select an insurance?
Are the parents also on Medicaid? The to if a person is a dual eligible, they are encouraged in Virginia to use one of these plans to help manage all of this mush. Have the person call us. I bet you there's something we're missing here, but no, traditional Medicare doesn't make you join one of these plans. No.
Okay. And what is the eligibility for SLMB plus?
Oh, that is help with the Part B premiums and some copays and stuff. And it let me go back. Or in the Medicare and You handbook, around page 90, you'll see those numbers. And I don't want to throw a number out on the air, and I don't have it at my fingertips because it changes each year. But for a single, it's in the high teens, and for a couple, it's in the low 20s. And call us, and I'll get you the exact number, or check the Google Medicare on that for the exact number. And but it's a big help to people.
Okay. Can you please explain hospital observation status and if Medicare will pay for the period of care?
Yes, it will pay, and this is one of the things we're going to really dig into in 102. But in about 1 out of 12 hospital visits, if I'd had that heart attack, for example, they took me to the hospital. It's hard to diagnose a heart attack, I'm told. I'm not a doctor. But they might say, Bill, maybe it was that burrito you had for lunch and you're having heartburn. We're going to observe you for days. They'll put me in a hospital bed in a hospital gown and feed me the food and that, and I'm there for days, but I'm not admitted. And that's important to know because when you're admitted, you pay that one big deductible. When you're in observation, Medicare will pay under Part B 20% of everything they do for you. Wow, that can mount up very fast to more than $1,632. More importantly, if I'm admitted, I start the clock for 3 days in the hospital to earn help with 100 days of rehab in a SNF, skilled nursing facility. If I'm observed, no, the clock doesn't run. And we've had a couple cases where a person thought they had been admitted, went to a SNF. After a couple weeks, the SNF said, hey, the hospital just told us you were never admitted, you were observed. You're not covered by Medicare. You owe us $30,000 in this one case. This got so bad that a couple of years, 2 years ago, the feds and the state of Virginia passed a law saying once you're in the hospital 36 hours, they've got to come to you. And if you're awake, talk to you as to your status or hand you a piece of paper telling you your status. We're not in control in the hospital. The hospitalists, doctors are. They're called hospitalists. But they like to make us happy. They want us to contribute to their charities and all. Agitate. We think in general, you or your spouse or friend should agitate to be admitted. And that will then help you earn that 100 days in the skilled nursing facility. It's a really weird thing. Pay attention to it because it can be important in how you're charged. But yeah, Medicare will come. Medicare pays. It just doesn't pay much in a SNF if you've been observed.
So we have a few more questions. For a new immigrant who doesn't have 10 years of work experience when turning 65, can he or she still get Medicare? And if not, what other options are there?
If you're legally here, yeah, after 5 years, and haven't earned the 10-year thing, you can at least buy in to Part A and B. It's expensive. American healthcare is terribly expensive. Part A is running over 500 a month for paying premiums. And alternatives would be check out again legally here a certain amount of time. Affordable Care Act, Obamacare, Medicaid after a certain amount of time, but it can be tough.
Okay. Let's see. I'm a retired U.S. government employee. I signed up for Medicare this year, age 65, and kept my FEP health insurance. I'm paying $500 a month total in premiums. If I decide to drop Medicare, do you think this is wise?
Read the book. There's pros and cons on it. It's a psychological question. If you don't worry, if you got enough assets that you're not worried about a couple hospitalizations where you've got a deductible and copays and stuff, you can go bare, if you will. If it's the kind of thing where you worry about it, get Part B.
All righty, and we have quite a few people in the Q&A that want to thank you so much. They are saying that you have given them a lot to think about, that you've done a wonderful job.
Thank you.
Let me make sure.
Well, tune in for 102. It'll get more interesting.
Yes, 102. So again, thank you. The slides for today will not be shared because the presentation is proprietary and not for distribution. We are at the end of the program. And what an honor it was to have Mr. Vaughan here today. We want to thank you again. The presentation was very informative. We thank you all for taking the time out in your busy schedules to join us today. We truly appreciate your commitment to learning and growing. Before you sign off, again, just as a reminder, please take a moment to complete the surveys that we've shared with you. Your feedback on the presentation is invaluable, and it helps us to tailor future topics to your interests. So our next webinar, as Mr. Vaughan mentioned, is next week, next Wednesday, October 23rd at noon. Registration is still open, so share the information, share the training. The training is for individuals who are interested in learning more in-depth details regarding Medicare coverage. The Medicare 102 session will provide an overview of advanced Medicare details, the latest regulatory changes, key legislative proposals, as well as provide individuals with an opportunity to ask more complex questions. The latest Medicare updates for 2025 will also be discussed. We look forward to seeing you next week at the next webinar, and we thank you each for joining us. Please have a good afternoon.